With all that has happened over the last year, healthcare workers and organizations have felt the need for information technology like never before. The pandemic has emphasized the need for automation in healthcare organizations, yet there are many challenges faced by the healthcare IT industry. Also, many patients are not fully engaged in digital healthcare and remain unaware of their services and its benefits. We at Medicircle have brought a new series on the healthcare CIOs and IT managers, where we are talking to the eminent IT personnel of healthcare and discussing the challenges and opportunities that healthcare IT shall bring about to the world post COVID. Hi, I'm Smita Kumar, and today in this series, we are going to speak to Ameen Reddy. Ameen is the IT manager at Herbertpur Christian Hospital, Herbertpur, Dehradun. It's a unit of Emmanuel Hospital Association, which is a charitable and non-profit organization with around 20 hospitals and 50 projects in 7 states in North and Northeast India. He's a dedicated healthcare IT professional with over a decade of experience. His expertise lies in hardware and software management, troubleshooting, and providing IT support to all the hospital staff. Amin also provides training to end users, including medical and non-medical staff of ERP software, as well as teaching the nursing students too. Hi, Amin. Welcome to the CIO series at Medicircle.
Hi, thank you for this interview.
Amin, to begin with, being a healthcare IT manager, what are the challenges you face while working?
Yeah, there are many challenges which are in the healthcare setup. One is a major is infrastructure. Where I'm working in the rural area, when I joined here, there's a lot of infrastructure issues which I faced. So slowly, like a couple of years, I struggled with the networking, and then the software which was working was not adequate for the needs what the hospital healthcare need to provide the better services to the patients.
Okay.
So slowly, and the second area which I face, that is implementing the software.
Yes.
So many areas where uh, the lack of understanding and the knowledge of the software and the illiterate of the software, and there I need to train them and need to give proper the support moral as well as technical side.
Definitely.
And the and this other thing, the third one is finances. So many areas we have to work for a minimum resources and give the best to the services, and sometimes we need to mm, cooperate with the management, because we don't sometimes there will be a lot of gap between the funding, and we need to struggle what we have. So slowly I overcome many things. Now we are working good and better in this hospital, and we are running ERP software now, and our network is very good now, and we are able to provide the services day to day near about 300 patients in a OPD, then around 50 to 60 IP patients. So there are a lot of joy and good things which are there in the healthcare setup. One of the reason why I am working with dedicating spirit. The reason is I could see the patient satisfaction, and the need the patient is coming, and the areas they're struggling. So it's IT is a background. It's like a background support, not only the like front line. So I I am doing the best.
Definitely, definitely. IT is really the backbone of the healthcare industry because it is not at all not only facilitating EMRs, patient records, seamless information flow, but also making sure that the patient is getting happily discharged from the hospital. Each paper and everything is there. He or she can get alerts on the phone. Everything can be accessed online. That is actually the beautification of technology post COVID. So moving on to my next question, Amin, digitalization is like the new mantra today, and IT has actually seen a shift from luxury to necessity. So, what basic aspects of IT, according to you, are required when it comes to healthcare?
Yeah, one major challenge now in the situation, digitalization is a very important aspect because now we are going ahead with the cloud technology
Yes.
and a central database, and then where we need to see everywhere it's a paperless work, and now a lot of modules what we are using, it's almost like we are using a digitalization and giving a report online to the patients, and where uh, many areas like the x-rays, and we are using pack softwares and giving the reports even wherever it's they're needed, they can uh, take soft copy also. So where we can see in the healthcare setup, lot of areas they need now fully it's digitally used, like paperless work. So where I was like when I joined here, lot of paperwork is going on.
Oh,
So now I can see most of the areas we are trying to utilize without the paper, like everything is computerized in wards and in many areas. So, and we are able to communicate across our 7 states if anybody is needed the services, and as well as online. You know this last 2 years in the pandemic situation,
yeah,
many areas we cannot travel and we cannot help even the patients also. We have a community, and our community people will travel and they will take a, it's like medicine with this soft copy and all, and they help to the uh, patients in
definitely.
distance. So in many areas I could see this IT is now it's a mandatory to know and to implement and to adopt the new systems. That's what I
Sure.
can say.
So as COVID has changed lot of things, like everything is now a new buzzword has come like digital. So moving physical
Yeah.
to being digital is the new mantra. So what is your take on that? Because hospitals have been taking online consultations. This might have been there in the hospital management software solutions long back, but it is the first time that doctors are using it, and also apps and other things where the patients can directly go and download their reports, find out their vaccination reminders, and lot more stuff. So, how is things changing post COVID?
Yeah, I do agree. The situation is changing now. Uh, this system was there earlier, but many of the medical team, they were not really interested to do that. They think that it's not a priority. Now, by seeing this situation, and we have a artificial intelligence, a lot of softwares which are like connected to the packs, and studying the reports and giving a feedback and the results, and there are a lot of researchers. So this all everything is becoming online. So the physical is obviously it is now digital, I
Mhm.
can say, because uh, given many patients telephonically ask this is what happening, and some guidelines they want. Until unless emergency, they are not willing to come to the hospital. So many areas, the patient side also, they are aware, and they are seeking for the this kind of support.
Surely. So we have talked a lot about how technology has disrupted the healthcare systems and how it is actually improvised the patient outcomes. So now one question related to your personal journey. So as an IT person, how has your journey been?
Yeah, this is a very important for me because I am glad to share my experience and my journey from the last 1 decade. Uh, when I joined here, I was uh, very new to the system because I'm an engineer and I'm not sure how I can help to the healthcare. So when I joined and I look back now, I'm really glad uh, I could uh, spend time. And the one thing which I uh, realized, or I can say that with experience and hard work and trusting on God, you will see the success. So I can say now, by the grace of God, I'm stable and happy and very satisfied person. Still, there are upcoming and the struggles are there, but I can say that I'm happy in my life, and I'm by seeing the patients, the joy, and sometimes they're uh, need a help, not only for the technical side, and sometimes they need a moral support. And one example I can say, sometimes they call Dr. G. So even I'm not a doctor, the feeling what they have, everybody in the hospital, they are like a doctor. And many calls I'll get, and they'll ask Dr. G if something has happened. Even I'm not a medical side, but I can take I mean, suggestion from the doctor as a mediator. I can like, tell them whoever I know. So that much I can share. I am glad and I'm happy in my life. So from the last 10 years, there are a lot of challenges and the struggles. I am very far from my hometown. My parents are there, but it's a commitment to me as I'm working for the Lord. Thank you.
Definitely.
That much I can share.
So very, very, very happy to hear from you, Amin. Uh, Actually, it's huge job satisfaction when it is just not actually job satisfaction. You are giving joys to patient, and happy patients are thanking you. Sometimes mentioning you as a doctor, and it really feels great that you are able to be a small part even of the healthcare system of the entire this continuum of care where patient is at the center, but you as an IT manager or as an IT person are helping the patients out in this need of their life, because again nobody wants to come to the hospital, and yes, getting healthy and going back home is really, really something good what they feel about. So thank you once again, Ameen, for joining us for the CIO series. We definitely hope that we are able to aware more and more people about the benefits of digital revolution that is actually happening in healthcare, and we wish you all the best for your future endeavors.